Okay, so in medicine, as we look at HIV today, we are looking at the following question. So the question that we are looking at reads, a 24-year-old Agnes Lemba is admitted to the female ward with history of anorexia, fever, cough, and after investigations, Agnes is found to be HIV positive. Question A is saying, define AIDS. Question B, explain the progression of HIV to AIDS. Then question C, describe in details the pathogenesis of HIV. And question D, describe the management of Agnes during her period of hospitalization. And the last question, question E, outline 5 preventive measures for HIV infection. So this is the question for HIV that we are looking at. In the last year when HIV was asked, the question of course had the nursing care plan, but this was for the other exam where HIV was asked. So we still mention the possible problems that we can use in HIV in case you are asked using a nursing care plan. So we'll go straight to question A on how we can define AIDS. So we can define AIDS as this is a blood disorder affecting the white blood cells caused by the human immunodeficiency virus, resulting in weakened immune system characterized by fever, diarrhea, and recurrent infections. So most we can be asked to define AIDS, like in the last exam, the question was the way this is, except it had the nursing care plan, but of course it started from defining AIDS. So in terms of AIDS, of course, the first thing we know is that it is a blood disorder, just like other blood disorders like anemia, sickle cell, or malaria. But this particular blood disorder affects a specific type of cells, which is white blood cells. And the cause of the damage to the white blood cells is the HIV virus. And when this happens to the white blood cells, what we end up seeing is weakened immune system. Hence, one of the characteristics we end up seeing is fever. And fever is an indication that, of course, there's something wrong going on in the body. There's a foreign organism, and this foreign organism is basically damaging the white blood cells. Apart from that, the other characteristic we see is diarrhea. One of the earliest symptoms we see in HIV infection is frequent diarrhea. And this is because of what happens to the virus when it enters the body. And we'll talk about the pathogenesis. This is why we see prolonged diarrhea in HIV or AIDS infection. Apart from that, recurrent infection, of course, because of reduced body immune system. So in terms of how we can define AIDS, this is how it can be defined. The next question is saying, explain the progression of HIV to AIDS. Now, when we talk about progression of HIV to AIDS, it's different when we say describe this HIV staging according to World Health Organization. So this question didn't have staging of HIV, meaning that as you study, you need to also read through the staging of HIV. In the notes, it's there, staging of HIV in adults and staging of HIV in children. In the notes, you need to read those components because it's different when they ask for staging and progression of HIV to AIDS. So when we talk of progression of HIV to AIDS, it has the following stages. The first stage, stage 1, is known as the infection stage. Now, during the infection stage, an individual just presents with the flu-like symptoms for about 14 days. And these flu-like symptoms will include symptoms like sore throat, muscle or joint pain, and swollen lymph nodes. Now, this stage, the first stage known as infection stage, mostly it goes unnoticed because these symptoms are not so specific. And even if I present with a cough today, no one will suspect that this is the earliest phase of HIV. Hence, it goes unnoticed. But one of the cardinal signs we are looking at is swelling of lymph nodes. When someone keeps on having tonsillitis, every now and then they're having tonsillitis, we suspect that they may be in the earliest phase of HIV infection, especially where this particular person never used to have a problem with tonsils as a child, but it has just started occurring in the recent past. And most of the time nowadays, when you go for tonsillitis treatment, we will need to check for HIV status, because it is the earliest sign we see when someone starts having frequency in swelling of tonsils. So on the infection stage, that is what will happen. From there, we move on to stage 2, and stage 2 is known as asymptomatic stage. Now, during this stage, an individual may live without symptoms of HIV for about 10 to 15 years. Now, when you, at this particular moment, remember when we talk of progression of HIV to AIDS, when a person is in the progression of HIV to AIDS, if you had to do a blood test, the blood test is going to come out positive. Hence, it is important that you do HIV testing at whatever stage. But then there's what is referred to as a window period, where it is a period where you may have the HIV infection, but if you did the normal Abbott determine blood test, it will come out negative unless you do other high level tests. That's where the positivity will be shown. But at this stage, when you're saying asymptomatic phase, which is stage 2, the person is able to test HIV positive, but then they don't show any signs whatsoever of HIV infection, because at this moment the viral load is still very low and the CD4 count is high, meaning that the immunity is still strong. Meaning that for as long as this person eats foods that promotes immunity, they may live without signs of HIV for about 10 to 15 years. However, this time frame is dependent on also the nutritional status and immunity of an individual before or prior to infection with HIV. Meaning that some individuals, even within 12 months after being exposed to the virus, they may still show symptoms of HIV because maybe they may have already had a weaker immune system. So that is about stage 2, known as asymptomatic stage. Then stage 3 is known as non-specific symptom stage. Now, during non-specific symptom stage, at this moment an individual begins to experience non-specific symptoms related to chest infections, diarrhea, weight loss, and other infections. So at non-specific symptom stage, the immunity of an individual starts dropping bit by bit, and they start having infections. Amongst the chest infections that will start becoming common at this phase, it will include the flu. This person will keep on having flu every now and then. This person may continue having maybe other respiratory infections like bronchitis and others. They may have other infections like pneumonia and many others. Maybe pulmonary tuberculosis will start becoming common at this point amongst other chest infections. Diarrhea also starts presenting at this moment. This person will have diarrhea maybe today, maybe it skips a day, they have diarrhea the other day, it skips maybe 3 days, maybe after that again they have diarrhea. So this particular patient starts having diarrhea almost every other day, but not continuously every day. And maybe it is just coming once or twice on that particular day, then they rest for some days and again it comes back after some days. And some weight loss is seen because of the diarrhea. The virus causes malabsorption in the small intestines, meaning that absorption of nutrients is reduced because of the increase in diarrhea and what is happening to the small intestines. Hence, weight loss starts to be seen at this particular moment at stage 3. Then stage 4 is known as opportunistic infection stage. And this is also known as the AIDS stage. So when we talk of the opportunistic infection stage, it's also referred to as the AIDS stage at stage 4. Now, at this stage, an individual's immune system, when you check the CD4 count, it drops below 200 per cubic milliliters. Apart from that, the patient may have severe infections such as candidiasis, pneumocystic pneumonia, tuberculosis, severe weight loss and muscle wasting. They may have severe diarrhea. They may have an increase also in sexually transmitted infections. So any other disease, they become very common at this particular stage, at AIDS stage, and that is why it is also known as opportunistic infection stage. The reason is because at this stage, infections find it very easy to infect this particular human being because the immunity is very weak. As a result, every small infection can easily manifest into a bigger infection. Like pneumonia, something that can easily be treated even without taking medication in an adult. Within 7 days, it may clear out, but it will take down this particular adult as if it is in a child where the immunity is very weak. And apart from that, tuberculosis may not just be pulmonary or limited to the lungs, but it may be extrapulmonary as well, spreading to other structures like the bones, the brain, the kidneys, other structures because the body's immune system is weak. There is a severe weight loss because at this moment the patient is having severe diarrhea as well. They are passing loose stool more than 2 or 3 times in a day and continuously. And if you look at the activeness of the patient at AIDS stage, they are bedridden for more than 50% of the days in a month because of such. So it is known as opportunistic infection because immunity is very weak. And an example I can give is that if you have a bestie, a male bestie, the moment you tell them that your boyfriend has dumped you, he's going to propose because that is now his opportunity. He has seen an opportunity that at that moment you are weak, you cannot refuse. And that is what opportunistic infections are. They see an opportunity when the body is weak. And at that moment, you are likely going to accept that bestie of yours because you just want revenge. You have been dumped. Your mind is not thinking straight. Your body is weak. So at AIDS stage, that is what opportunistic infections do. Then the last stage of progression of HIV to AIDS is stage 5, and stage 5 is known as the death stage. Now, when you look at the treatment for HIV, treatment for HIV or use of antiretroviral treatment is effective from stage 1 all the way to stage 3. But when the patient reaches stage 4, which is AIDS stage, no matter how much you give in terms of ARVs, you are only sure that the condition will move forward and the patient is going to reach the end stage, which is stage 5. That is why treatment is encouraged to be started up to stage 3. But at stage 4, no matter how much you do, you are sure that the patient is moving on to the last stage. It's just a matter of months. And the patient moves on to stage 5, which is the death stage. And during the death stage, an individual dies from any opportunistic infection, meaning that the patient may be infected with malaria, uncomplicated malaria, but the patient dies from uncomplicated malaria because their immunity is very weak, or from pneumonia, or from TB, or from meningitis, sometimes even cancers. So all these opportunistic infections, the patient may easily die from any of them because the body's immune system is very weak. So when we talk about progression of HIV to AIDS, these are the stages that you need to write. Is it clear or there's any clarification before we move on to the next question? Okay, so we can move on. The next question says, describe in details the pathogenesis of HIV. So when we talk about the pathogenesis of HIV, the first thing that you need to understand is that the virus targets specific cells in our body, And these specific cells are known as the CD4 positive. So the CD4 positive T lymphocyte cells. Now, our body is also born with white blood cells that are known as CD8 cells. Our body is also born with white blood cells that are classified as CD4 negative T lymphocyte. Now, when we talk about the HIV virus, it can only replicate and reproduce in the parent cells known as the CD4 positive T lymphocyte cells. When you look at our body is made up of T lymphocytes, which are parent cells, meaning that these T lymphocytes can reproduce different types of white blood cells. When we talk about different types of white blood cells, remember there is eosinophils, there is basophils, there is monophils. There are different forms of white blood cells, but these different forms of white blood cells and plasma, including red blood cells, they come from parent cells that are known as T lymphocyte cells or B lymphocyte cells. So in this case, we are saying in the pathogenesis that once an individual is exposed to the HIV virus, the virus will enter the body and find a suitable host cell, which is a CD4 positive T lymphocyte cell. And once a CD4 positive T lymphocyte cell is found, the virus is going to penetrate the cell. So whatever the cause is, sometimes we may get the virus because of sharing maybe sharp needles. Then we prick ourselves and we don't take PrEP, and then the virus enters the body. Sometimes it could be penetrative sex. When we talk about penetrative sex, it means that there is penetration, because some of the sexual intercourse that we may have are never referred to as penetrative sex. Hence the friction is less, where we can see exchange of blood. But whatever the case is, where there is penetrative sex, there is increase in friction. And because the vulva expands to accommodate the penis, at the same time also the penis expands because of the sexual arousal, that friction easily causes breakage of the mucosa that lines or the epithelia that makes up the penis or the vulva. And during sexual intercourse or penetrative sex, there's a higher chance that there's going to be minute cuts that are going to cause exchange of blood during sexual intercourse. And that is where we see a higher chance where we get the virus through sexual intercourse. And apart from that, also, when we talk of preparing the woman properly, those of us who have done counseling, you know what we talk about when we say you prepare a woman properly, because it matters as well. If the vulva is not properly lubricated, you are having dry sex, this friction is high, and because the vulva and the penis have high amount of CD4 positive T lymphocytes, hence we see that the virus can easily enter the body. But in those individuals who are born with CD4 negative T lymphocyte, no matter how much they have sex, they with a positive person, they can't get the virus because you are born with wrong cells where the virus cannot replicate. So maybe that's why some of you have been trying, but you have not turned out positive. Check your CD4 cells. Now, in this case, we are saying once the virus finds a positive T lymphocyte cell, the virus is going to attach to the receptors. So if this is the virus, if this is the CD4 cell, the virus is going to attach to the receptors of the cell. And once that attachment happens to the receptors of the cell, the virus will be pulled closer to the CD4 cell. And at a point where the virus and the CD4 cell attach, the membrane is going to dissolve. And when the membrane dissolves, it is going to allow the virus to enter the inner part of the cell. Now, once the virus enters the inner part of the cell, certain things has to be done. The virus is going to produce 3 enzymes. Now, Amongst those three enzymes, the virus is going to produce what is known as a reverse transcriptase enzyme, the protease enzyme, and the integrase enzyme. At the same time, the virus will also produce 2 strands of RNA. So what we mean is that the virus produces 3 enzymes, and apart from 3 enzymes, it produces 2 strands of RNA. When we talk of RNA, remember RNA, we say it is a single strand, but DNA is a double strand. So those 3 enzymes have to change the structure of the CD4 cell to the structure of a human being. Remember, us human beings are made up of DNA, meaning that the RNA of the virus cannot be inserted in the nucleus of the CD4 cell the way it is. It won't be accepted. As a result, those 3 enzymes come in. And the first thing is that the reverse transcriptase enzyme is going to mix the viral RNA into viral DNA. So what will happen is that the reverse transcriptase mixes the viral RNA into viral DNA, and it becomes a double-strand viral DNA. Then the integrase enzyme job is to integrate or mix the viral DNA into human beings' DNA. So at that particular moment now, this CD4 cell inside the nucleus will no longer be producing white blood cells, but it will now start producing viruses because the DNA structure has been changed. This CD4 cell has received new information on how to produce cells, but it is not now producing cells that protect the body, but it is now producing cells that are going to damage the body cells. Then when we talk of the third protein, which is the protease enzyme, the protease enzyme will make sure that whatever proteins that this individual is eating, they are only used when the body wants to produce more viruses. And that is why we see diarrhea being severe in an individual with HIV. The reason is because we have villi in our small intestines, which is replaced daily. And villi is a protein in nature. Now imagine the virus is keeping proteins to itself and not releasing to the body cells, meaning that this villi won't be replaced, it will be depleted. And when there's depletion of villi, meaning that food can't be absorbed once broken down. As a result, if there's malabsorption in the small intestine, then the end result is severe diarrhea. And at this moment, that's how come we see severe diarrhea. At the same time, the membrane that was covering the virus, when the virus was approaching the CD4 cell, it remains the membrane covering the entire infected CD4 cell. So the virus is very smart, because by doing so, it means that the other white blood cells of the body will not detect that this CD4 cell is infected, because if the other white blood cell detects that, they can easily destroy this CD4 cell and prevent the virus from replicating. But the virus is smart such that it leaves its envelope, which was protecting it, to protect the CD4 cell so that other cells cannot notice that the CD4 cell is infected. So the host CD4 cell, this one which is infected, it only realizes that it has ingested the wrong cell once it is already in, because the job of the T lymphocyte cell is also to break down the damaging cells. But then at this moment, it has ingested the wrong cell that is causing damage to itself. And as a result, some of you only noticed that this man I'm dating is a monkey, is an animal, after he was already inside your life. But when he was coming and proposing, he came very humble, very nice, taking you out all over. But at the moment he left you completely damaged, because you only noticed when it is already too late. So that is what is happening to this CD4 cell. So at this particular moment, from the pathophysiology, when more white blood cells or CD4 cells are damaged in this particular manner, the body's immune system is going to drop. And once the body's immune system drops, an individual now will start having opportunistic infections from TB, cancers, different cancers from benign prostatic hypertrophy, cervical cancer, and many other type of cancers, meningitis, increased frequency of STIs, tuberculosis, pneumonia, many other infections become common because of body's reduced immune system. So when we talk about the pathogenesis of HIV, that is how it happens. And in the slides when I share, you are going to have the description of what I was explaining. So no need to worry about to write, because I've already included it in the notes. Unless there's a question or clarification. The next question was saying, describe the management of Agnes during her period of hospitalization. Now, this means that the way the question is, it means that you need to start from medical management, then you go to nursing management. Yes, is there a question? The medical management, of course, you start with the investigations. On investigations, you can talk about history taking, and history taking, you can say it will review history of multiple sexual partners. Now, like I mentioned, the last time HIV came for the diplomas, it came under pediatrics. Now, people ended up writing the child will present with history of multiple sexual partners. Now, that history becomes wrong immediately. It means that you just memorized. Because where in this world are you saying this child already had multiple sexual partners? So for a child, at least you can use history, like the child will present with history of mother to child transmission. At least that history makes sense rather than multiple sexual partners. This one, unless in an adult. Then physical examination, you can say the patient will present with weight loss, fever, and prolonged diarrhea. Apart from that, you can do other investigations, which are lab investigations, like Abbott determine, which will come out positive for HIV. And Abbott determine is the common one that we do when you go to the hospital, the clinic, any clinic, you say you want to check for your HIV status. They'll get the blood, put it on the slide, add the buffer, then within 15 minutes it will show either 2 lines or 1 line on the control tag. Then you know whether you are positive or negative, and that is Abbott determine test. And this one will come out positive for HIV. Apart from that, we can do Unigod tests to confirm the presence of HIV. Now, Unigod test is a confirmatory test. It means that when someone refuses the test from Abbott determine, which is true because Abbott determine is not 100%, meaning that it has a higher percentage of a false error because of a higher, because of a lower significant rate. So when someone refuses a test from Abbott determine, remember there's those ones for oral and there's one for pricking. But between the oral and the one for pricking, the one for pricking is more accurate. The one for oral, if you have not brushed your teeth and you do it early in the morning, it's going to come out positive. If you have any mouth infection, you do the oral test, it will also come out positive. If you have not eaten anything the whole day, because in the saliva there is bacteria, and you do the Abbott determine, it will come out positive. So maybe some of you had unnecessary headaches with the oral one. It is because you took the test wrongly, and it is less effective that way. So the pricking one is more effective. But when Unigod test come out positive, it means that you are positive, whether the Abbott came out negative or the Abbott came out positive. When Unigod test come out positive, it means that you are HIV positive because it is a confirmatory test. Apart from that, also SD bioline test will confirm the presence of HIV. So SD bioline test, it is also a confirmatory test, meaning that when you go to the hospital, you say, no, I did a test, but I have not accepted the result. It was positive. They won't repeat abort. They'll either do Unigod or SD Bioline. In the hospital, because we can't pronounce these two, we'll just say we have indicated the patient for PCR, because PCR and our English, we easily pronounce it. But you never hear nurses saying or doctors saying, no, we are doing Unigod or SD Bioline. But what we call as PCR is the same Unigod or SD Bioline, because PCR will just check the antigens. Then these two will confirm the antigens to the antigen of the HIV. That is why they are known as confirmatory tests. So in terms of investigations, at least you mentioned 5 investigations, and these are the possible investigations that we can do to confirm HIV. So once you have 5 investigations, then you can talk about treatment. Now, for treatment for HIV, you need to mention, first of all, immediately you say treatment, you need to mention the abbreviation of the drugs that you are using. And currently in Zambia, for almost all the diseases, including pregnant women and other individuals with any other underlying conditions, you can still give this combination here. That is why I put it in the notes, because it's easy for you to remember. But other combinations are only specific to certain states. For example, if a woman is pregnant, you can't use it. Meaning that even those who are doing midwifery, you may have HIV in a pregnant woman, and you can still use this combination, because HIV can also come in a pregnant woman under midwifery. So you need to write the abbreviations, which is TDF for tenofovir, 3TC for lamivudine, and DTG for dolutegravir. But if you're talking of children, you can easily give this combination for ABC, which is abacavir, 3TC for lamivudine, and DTG for dolutegravir. But most children under 6 months, this DTG is replaced with NVP, which is nevirapine, because dolutegravir is a bit toxic to children under the age of 6 months or children weighing below 30 kg. Hence, we see that DTG is replaced with NVP, which is nevirapine. But on these 3 drugs we have mentioned, for TDF, which is tenofovir, you can give 300 milligrams, which is once daily, orally. The mode of action of tenofovir, it is a nucleoside reverse transcriptase inhibitor. It has side effects like diarrhea, hepatotoxicity, nephrotoxicity as well. The nursing implication, always monitor renal function to rule out nephrotoxicity. Apart from that, 3TC we said stands for lamivudine, and for lamivudine we are giving 300 milligrams as well, orally, once daily. Mode of action, it's a nucleoside reverse transcriptase inhibitor. Side effects, generalized body weakness, vomiting, peripheral neuropathy as well. You just need to mention 2 side effects on each drug. Nursing implication, advise the patient to take the drug after meals to reduce its side effects. The third drug, dolutegravir, this is one of the new drugs that were there, because in the old one, we used to have zidovudine as the third drug. But DTG reduces the viral load very fast, such that most of individuals nowadays, they are undetectable because of DTG. But we don't know, with the pulling out of our funders, we don't know how people will survive, because all these were being given through US, hoping that we'll manage to buy or something will come up so that people can still access the required treatment. So for dolutegravir, it's 50 milligrams orally, once daily. Mode of action, this one is an integrase inhibitor. It has common side effects like hepatotoxicity, depression as well, and nursing implication, you monitor, you do a liver function test to rule out liver damage. So in terms of drugs that we can give, those are drugs, but you need to also read through the dosages for the others. For example, in children, we said you give DTG, the dose is the same 50 milligrams, but NVP is 5 milligrams per kg body weight. And when we talk about drugs for HIV, they have no duration. You can't say for 5 days, because the patient is taking them for life until either they reach stage 5 or not. So in terms of drugs, that is what we can mention as we treat an individual for HIV. Then when we talk of nursing management, we are using general eprophenema, and this outline we have looked at it several times, so it's just general nursing care. But in case we are asked for nursing care plan, these are some of the possible problems that we can use, because sometimes the question will say, using a nursing care plan, explain how you manage the baby. And people struggled identifying problems because it was HIV in an adult or a baby. So in case of a nursing care plan, you can talk of altered nutritional status. And altered nutritional status is related to impaired absorption of nutrients as a result of diarrhea, evidenced by weight loss. Then the other nursing diagnosis is altered thermoregulation. Altered thermoregulation is related to presence of the human immunodeficiency virus in the blood, evidenced by temperature of 39 degrees Celsius. We can also see other symptoms, other problems like fluid volume deficit related to increased loss of fluids as a result of diarrhea, evidenced by poor skin turgor and sunken eyes. We can see other problems like activity intolerance related to increased fatigue and diseased state, evidenced by patient being bedridden. And the fifth problem we can talk of is risk for infection related to reduced body immune system as a result of viral infection. There are other problems you can see, including knowledge deficit and anxiety. There are cardinal problems also seen in HIV. But at least these are the main specific ones for HIV, inclusive of either anxiety or knowledge deficit. So in case you're asked for a nursing care plan, these are the problems that you can use. In case it is a nursing care plan in a child, the only problem that you cannot put in a child, if the child is below 10 years, it is activity intolerance. Unless maybe the scenario says the child is 14 years or above 10 years, then this problem can apply among others. But if the child is below 10 years, then you can put maybe a risk for impaired skin integrity. So risk for impaired skin integrity related to increased loss of fluids in diarrhea, resulting in breakage of the skin or reduced tissue perfusion. So that is a risk we can see in a child, because you can't also use knowledge deficit in a child or anxiety or activity intolerance if the child is below 10 years. So I'm bringing up this because HIV can also come under pediatrics, and whenever it comes under pediatrics, it will always have a nursing care plan. So that is about how we can manage HIV. Is it clear before we move on to the last question? Okay, so our last question was talking about preventive measures of HIV infection. Amongst the preventive measures, of course, practicing safe sex. You talk about use of a condom, and you advise the patient to use a condom whenever they are having penetrative sex. And you, of course, on use of a condom, the male condom is more friendly because you can use it instantly. But when you talk of a female condom, the woman has to wear it maybe 6 hours before sexual intercourse, and maybe that's why we see that female condoms are not marketable highly, because it means that it is only one round, then you have to wait for 6 hours for the next sterile procedure, which is not practical. Then apart from that, also limit the number of sexual partners. This can reduce HIV transmission. Getting tested, knowing the status of yourself and the partner, all those are points on practicing safe sex. Abstaining, yes, it does not work at the moment, but abstaining can also be a preventive measure, because nowadays we don't even talk about abstinence. We used to talk about condomizing. From abstinence we said condomizing. Right now we just say practice safe sex. We don't even know what it means anymore, because we don't even know what we mean ourselves as people are saying practice safe sex. So abstinence can be used, because when we abstain from sexual intercourse, we are reducing chances of contracting HIV. Use of pre-exposure prophylaxis. Right now we still have pre-exposure prophylaxis. The same combination of lamivudine, dolutegravir, and also the other drug, tenofovir, can also are still being used as pre-exposure prophylaxis, where you take a tablet continuously for 7 days. Then it means that after 7 days now you can have unprotected sex even with an HIV positive patient, but still continue taking the drug and you're still protected. We saw an introduction of an injectable PrEP. In Lusaka, we are giving it free in all the universities. I don't know how other provinces, including the PrEP, we are giving them free in all the universities. But because at the moment we won't have funding for this, I think the programs have been stopped, so that whatever is there can be given to other individuals. So we can use PrEP as one of the preventive measures. We can also use post-exposure prophylaxis also as a preventive measure for HIV infection. Also avoid sharing needles and sharp objects, especially to those who are drug addicts. This can reduce the chances of contracting HIV. Also, just the health education and behavior change, meaning that public campaigns on promoting safe sex practices and the health education about HIV transmission. People can have a mindset change and be able to use protective measures whenever they are having sexual